Helena, so how many days a week do you work? So this will be also the question.
Yeah, I work 36 hours. So that means that I work 1 week 5 days and 1 week four. So yeah, I was always used to working 40 or more than 40. So for me, that feels that week that I have 4 days, it feels a bit like I have a little weekend in the middle
Yeah,
of the week because I have Wednesday. So then, yeah, it feels very nice. Yeah.
it's very nice. I would say 32. So, ooh. And how many hours a day so then you work?
Oh, a normal shift. My shift starts at 8:30 and we finish at 5. And I have like a pause, like 30 minutes. So that's like 8 hours, something like that.
Hmm.
Yeah.
Yeah. So 8 hours a day. Yeah, sometimes 4 days, sometimes 5 days, right? Oh, nice, nice. Yeah, so I think this could be also attractive to the people because, of course, everyone wants to have some more time for, yeah, private life. So,
Yeah.
mm.
And for cleaning. I don't know if people do cleaning, cooking, put in a washing machine.
Yes, it is. A lot of
People
things,
always
yeah.
think like, oh yeah, that's pretty. We're going to festivals and so on. It's like, yeah, actually, no. Today I put a washing machine and I'm proud
Yes,
of myself.
I have. Yeah, I understand what you mean. And vacations, how many vacations do you have?
Yeah, I'm not so good with that. I think we just have a bit like what's the regular thing, like 25 days, something like
I
that.
think I read for the Holland, it's 20, so
Oh
regular.
yeah, it could be. Yeah, I am in my job, but that's a bit yeah, different or special from the work I'm now on. You have also some money aside. That's normally what they do in the Netherlands. That they give you for you to like invest in yourself, so you can use it for um, doing, for example, studies or
Mm-hmm.
courses or going to conference where you have to pay the attendance. And if you don't use it for that, then you can also use it to buy more holidays. And that's normally what
Mm.
I do. Or you can also
Mm.
just say, well, no, I think you have to use it for something. So that's
Mm-hmm.
why maybe I thought I had 25, but okay, let's just say it's 20. And then I
Yeah.
sometimes use it yeah, to buy more
Mm-hmm.
holidays.
Yeah, maybe 20 because, for example, in Sweden, the system was that each year you work, you get some, yeah, some more holidays. So I don't know, maybe
Yeah, I don't
something
think
similar.
in the Netherlands it's not like that. But for example, something very good is that when I think you reach to be 60 years old, you can go home an hour late earlier
Oh,
or half an hour earlier, something like that. My
they're
colleagues that are
thinking.
60 years old go a bit earlier home
Yeah. Oh,
without
nice.
being deducted. So yeah,
Yes, they're thinking about the seniors, so that's very
yeah,
nice.
yeah, that's
Okay.
nice.
And what else I wanted to ask you about your work? Mhm. So, the questions. Mm. You mentioned that you've been living in the Netherlands for 6 years, so it means which year did you come in to the Netherlands?
December 2019.
19. Okay, so that's okay. Okay, so that's perfect. And what would be your long-term plans? Would you like to stay in the Netherlands and
Well, I've been already for quite some time. When I
Yes.
discussed this with my family, they said,
Yeah.
okay, you go 1 year, you live the experience, you come back. And I said to
Yeah.
them, of course, I go 1 year, I live the experience, and I come back. Now, I lied, of course, because I'm still here.
Uh-huh.
But
Yeah.
yeah, we bought this house where I am
Ah.
last year. So I have
Oh.
a mortgage. So I'm not
Mortgage, so you need to stay
planning.
there.
No, I'm not planning to
But the
go
house,
back
it's
to Spain very
expensive,
soon.
no?
It was
Sorry.
expensive, yeah, but
How much could you pay for a house in Amsterdam or where is it?
no, it is where I we lived in Amsterdam, and my boyfriend had his apartment, so I paid him, and but we were looking to buy together and to buy also a bit bigger so that family members could come visit and also stay with us because we lived in like a little apartment. But in Amsterdam, it was like very little apartments were a bit expensive. So we had to look, and I live like in between Haarlem and Amsterdam. So there's a bit of green there, and it's perfect
Yeah,
because
I
I'm very
see.
close to the city.
Yeah, so I think we have Johan joining us today. No, I don't know if I pronounce it correctly. Yeah, so we are waiting a bit more, yeah, for others to join, and then yeah, we could start at 6 o'clock. Yeah.
Johan, is it possible to know where you come from? I don't know if you can speak or put the camera on. I don't know if you can do that, but you can
Maybe
also write
no.
in the chat.
It
Yeah.
depends, yeah. Maybe if the person is at work or traveling or doesn't want to do it. Sometimes we are shy. Hello.
No, but
Yeah.
I think it is because he had the same problem I had with the other account that I could not speak or
Oh.
put the camera on.
Yeah, if the person
We
is
see you say
willing
hello.
to put something, then
Yeah, it's always interesting to know where you're from.
maybe Spain, no?
Hola. No, no. Pineda. So it could be, I don't
It
know.
could be, no?
Could be.
Let's see his answer. No,
It's Spanish. He
conseguirá.
said, yeah,
Ah,
he's
he will
saying he doesn't know
activate,
how
no?
to, yeah, but he doesn't know how to do it.
Like a
So
microphone.
I think he may have the problem that he's not allowed to do it. Like,
Yes, probably because we have the organizers, yeah, and then we have the attendees, probably. That's why. Let me see.
Johan, ¿puede ser que no te deje Teams hacer esto? Puede ser, pero no te preocupes si tienes si no lo consigues, pon cualquier pregunta tanto en inglés como en español y yo la traduzco y la respondemos, ¿vale?
Mhm.
I was just explaining to him that he can, even though if he cannot do it, just put your questions in English or in
Yeah,
Spanish
so this is the most
in the
important
chat.
because, yes, we can. And Helena, as she has this experience working as a nurse in the Netherlands, so you can, yeah, ask her her
Time to ask
questions.
questions. It's now or never. No,
Yeah, in
not now or
Spanish
never.
or
But
English, right?
yeah, yeah, it's all good.
Yes. Okay, let's see. Yeah, we have some more minutes to do. So they are welcome to join. We are very glad to have you here tonight. Yes, my name is Natalia, and here's Helena in the Netherlands. No? Yeah, today we will talk about how you can start your career in the Netherlands as a nurse or a nursing assistant. And yes, we'll go through this and we'll have the interview with Helena, as I mentioned. Yeah, let us talk about ourselves. But before I proceed, I wanted to mention that this webinar will be recorded, and then the recorded version could be sent also to other candidates who registered before, just for you to know. Yeah, but okay. So about us. So Helena is an ambassador at EMTG Healthcare, and she works as a registered nurse in Amsterdam, in the Netherlands. She has been living there since 2019. Yeah, she will.
Long.
Yeah, a long time. She will tell you about this.
Nice.
And yeah, myself, I'm Natalia. I also work for EMTG Healthcare as a talent acquisition specialist. And I have experience recruiting medical professionals for more than 10 years.
Nice.
So today, what we will talk about? So we will talk about um, why you should choose the Netherlands. We will also go to the nursing in the Netherlands. Here we will talk in details about the structure of the Dutch healthcare, about the roles and the responsibilities of the medical personnel, and we will talk also about the salaries that you could expect to earn if you work in the Netherlands as an assistant nurse or a nurse or a nurse. And also important, we will tell you more about our company, about the MTG Healthcare, and why you could choose us as your partner. We will also explain you about our Dutch courses. We have the Dutch courses. Yeah, they're held in Academia Neerlandesa in Spain, but we will tell you more about this later on. And then we will have the QA section with Helena. You are also welcome to write your questions in the QA part or in the chat, and then we can read them, or you can ask the questions yourself with audio if you decide. So let's start with why choose the Netherlands as your next destination for your career. So the most important would be the high quality of life. Netherlands is ranked one of the top countries with its safety, sustainability, sorry. Yeah, so work-life balance. Here you can, oops, just one second. There was someone else waiting in the lobby. Just let me see. I'm just sorry. Helena, if you see someone in the lobby, or you cannot maybe do this now.
I don't know.
If you can. Oh.
I think the person is already here.
Okay, if there will be someone, so maybe you can, yeah, you can tell me something, yeah, that there is someone waiting. So you can expect to have a work-life balance. Yeah, in the Netherlands, you can work 32 hours a week or 36 hours a week. It means that, for example, 2 weeks you can work 5 days a week, and 2 weeks you can work 4 days a week. So having more time for your personal things, so which is important for everyone. And we can also say that the Netherlands, they have a very strong healthcare system. In the Netherlands, the country spends about 10% of the GDP for the healthcare. And if we if we say it in the numbers, it's 100 billion euros on the healthcare system. So that's why it makes very strong and attractive in the Netherlands. Yes, yeah, you can benefit from this healthcare system as a professional and also as a patient if you need something. Um, yes, and also the Netherlands is ranked on the third place in 2021 of one of the safest healthcare systems, according to Normbir. Yes, leaving behind Japan, Austria, and France. Mhm. And in the Netherlands, probably most of you know that they have people from the different countries, meaning that you could work with people from other countries, enjoying this multicultural environment. Yes, you can also see that a lot of people speak their English. They maybe about 95% of people speak English there. So yeah, it could be also something an attractive point, especially in the beginning. And in the Netherlands, you can also benefit from the opportunities for career growth. Yes, you will not just have the job, you will have the career. And the employer will encourage you to to update your knowledge, to go and study more, to do some courses, conferences. This is very, I think, important for a healthcare professional to be up to date with the information, with the knowledge, with to gain some more skills that are needed. And nursing in the Netherlands. Dutch healthcare system. In the Netherlands, they have this universal healthcare system. It's it's paid from several incomes, so it's paid from several sources. It's paid from the everyone insured. It's also yeah, so the person pays monthly income, then the person also has a contribution of the year, and also the government helps and also gives the part for the healthcare. So that's why this universal healthcare is sustainable and yeah can yeah lead to progress also for the patients and for the personnel. So they have mandatory insurance for all residents. Yeah, like in most countries, free coverage for children and under 18. Yes, and as I mentioned, it financed the yeah from the contributions, fixed monthly premiums, and government supports. And the government regulates the system, but the insurance companies they provide the coverage, which is important. And how is organized the care delivery structure? So firstly, there are the primary care, the GPs, general practitioners, who plays as gatekeepers, and then there is the secondary care with the specialist consultations via GP referrals, and after that it's tertiary care with advanced treatments at university hospitals. What is also important to know for the nurses are the nursing levels in the Netherlands. So the Dutch nursing system is structured across 8 levels, with most practicing nursing falling between level 1 and level 6. And now we can have a look at the levels, and yeah, I can explain you a bit more about these levels. So firstly, the first and the second level goes for the stands for the care assistant or the helpender. These healthcare professionals they provide the basic support, yeah, basic personal care, and the training that they usually have is 1-2 years. After that, it comes to the nurse assistant, or in Dutch, it's verpleegkundige. And here the nurse assistant yeah, provides more care, also personal and basic nursing care. After that, we have the nurses level 4. At this level, the nurse is fully qualified and the nurse provides care to the patient. So it could be, yeah, yeah, they have the bachelor degree, usually that lasts 4 years. So they provide the independent care, and yeah, for example, wound care and yeah, other important care. Then the level 4 is the nurse. Here the nurse also yeah provides the care to the patients, but here the nurse usually has a bit of leadership yeah position, and the nurse provides a more complex care. So more nurses, we can say they work also at level 4 and level 5. Mm, After that, if you would like to work in advanced practice or to work in academics, of course, you will fall from level 6 to level 8. You can be a nurse specialist and become a nurse specialist after training and after studies. So the nurse specialist, they can diagnose and also prescribe certain medications, and you can continue with research activities, PhD, and so on. Mhm. The salaries in the Netherlands. Here we can see the salaries for the helper, for the assistant nurse, and also registered nurse. For the care assistant, with the training 1 2 years, the person could expect to receive about 37,000 euros annually gross. Yes, as an assistant nurse, you could expect to have 37 to 48,000 euros gross annually. And as a registered nurse, here we can say, level 5, level 6, no, sorry, level 4, level 5. The salary could be 38 to 58 thousand euros gross annually. And in the first year, when you will arrive to the Netherlands, the taxes, you will pay less taxes. You will pay about 25% of tax. Because you're a newcomer and you will have a tax reduction in the first year. And EMTG Healthcare has job offers for nurse assistants, for nurses across the Netherlands. So it could be in the northern part of the Netherlands, it could be central part, and also southern part. Some locations could be quite small, yes, but they're very close to the bigger towns or cities where you could also live and work in a smaller location. So we have positions in elderly care facilities, in home care. We have also in mental health facilities and hospitals and clinics. Next question would be, why choose our company as your partner in finding the job in the Netherlands? Firstly, because we have experience. Your career is your success in your career abroad is our goal. AMTG has played more than 900 healthcare professionals in the Netherlands. We could offer you the job security, individual approach. We will offer you Dutch lessons. We can also offer you the support during the first year. You will also have a mentor when you arrive to the Netherlands who will help you with your job. He will go with you at your first working place, and he will be there with you and assisting you if you have any questions or any issues during your work. We will also help you with the Dutch nurse registration, and we will also assist you in finding housing. Dutch language. So before relocating to the Netherlands, it will be important to know Dutch language and have B1 level of Dutch. So that's why we have designed, EMTG has designed this program to so that you will master your Dutch, and then you will relocate to the Netherlands and you will start working there. We will invite you to our course, which is held in Spain. It's close to Valencia. There you will spend up to 4 months studying super intensively together with other nurses. You will be provided with accommodation, also with the meals during your stay there, but you will have to study super intensively 6 days a week from 9 till 6 o'clock. But at the end of this course, you will get good results. You will have B1 level of the Dutch language, which is essential for the big registration in the Netherlands. So we will also, you will have some focus also on the medical vocabulary that will help you in your work in the Netherlands, also real life scenarios and some cultural understanding. Yeah. And the next part of our presentation would be the questions with Helena, our interview with Helena. So maybe I will come back. Let me see. Oops. I will stop sharing. So now I think we can talk if someone has the questions, but let me see. I have prepared some questions to Helena, so maybe I can start. And during our conversation, you can join and ask also some questions. Yes. The first question would be, Helena, where are you now?
Well, thank you so much for your presentation, Natalia. I think it was pretty clear, everything. I'm now in my house. It's a Wednesday, it's winter now. I'm in the Netherlands, and I've been in the Netherlands for almost 6 years. I moved to the Netherlands on December 2019, so just before the pandemic. I didn't know that that was going to happen. So yeah, but I'm still here.
Yeah, so many years, impressive, I would say.
They
And
go fast.
yeah, you came when it was the hardest, I would say, this pandemic. Tell us, why have you decided to move to the Netherlands? You are from Spain, right?
I'm from the Canary Islands in Spain, and I don't know how is it in other countries, but in Spain, we normally don't get very much stability in our jobs. Normally, we get called and we get jobs offers from the public healthcare system. So that means that sometimes, if you're lucky, you get a bit of a longer job, or sometimes you get offered a couple weeks somewhere, and then you wait until you get another job offer. Of course, you can also work in a private system, but that's normally a lot of hard work. So for me, it was mostly the stability. I was changing from one department to the other all the time, so I couldn't learn much. I was all the time kind of like trying not to make mistakes. So for me, the instability at my workplace made also my work balance between my private life and my job not the best. So those were already many reasons. And of course, if you don't have an stability in your job, you also don't have an stability in your income. So that way, I also didn't see myself growing in, for example, saving money and etc. So those were already some decisions I had to make. Plus, I was very curious to know how it was to work in another country.
Thank you for this answer. And tell us about your journey. So, how did it start, the journey of relocating to the Netherlands? So, first, of course, it was with the language, right?
Yeah, well, I think a very important thing if you're planning to move to another country is to gather a lot of information, ask a lot of people that have moved there, how they did it. Now I found EMTG. It was for me also very clear the steps I had to make. I moved to Academia Neerlandesa in September 2019. And everything is super intensive, so it is a lot of hard work when you're there. And of course, you're there the first week and you're thinking, oh, I'm learning the days of the week. How am I gonna in 4 months work in Dutch? Like, how is that possible? But it is so intense. It is a lot of work, but you don't do it alone. I moved there with other nurses and nursing assistants from Portugal, Italy, also from Spain, from England, etc. So it was easier to do it because we were doing it together, you know. So we would, after the lessons, we would also like do our homework together, but also have our free time. We would like go to the beach in Alicante, and so after some time you have also your own routine. So yeah, it is hard when you're there, but it's not so hard as you think before moving there.
Yes, and what was the most difficult part of learning Dutch?
Um, wow, that's I have to no. Look, for me, I took it as I took it very positively. I said to myself, okay, my job is in these 4 months to do one thing, learn Dutch. So I tried to organize myself a lot. I think it was the accent. I have a very hard Spanish accent, and nowadays my colleagues they can still hear it, of course, but that's no problem. I've always worked in very international teams, so I was not the only person from another country. Yeah, but I think the sounds that you have to make to speak Dutch, like the goeiemorgen with a lot of ges, stuff like that, is a bit more challenging for Spanish people. I've understood Portuguese people can do it very good, but I think that, and of course, you have to learn a lot of new vocabulary every day, around like, I don't know, 15 to 20 words a day. So I think just remembering them was a bit challenging, but I don't know. You can also do, I remember at night we would watch movies in Dutch with subtitles, like for example, Harry Potter in Dutch, and that way you will start to develop an ear for that. So,
Mhm.
but I
And
think the sounds. Yeah.
sorry, yes, I agree. So, and at Academia Neerlandesa, did you make any friends with the nurses you were together?
Yeah, from my generation of, we call it like that, from the people that were there those 4 months, I still have many friends. We were also lucky that most of us are still here. I think we were about 15 people, and only two came back for also personal reasons to their own countries. So yeah, we see each other on a regular basis, and I did live my first year with some nurses that did also the same as I did. Only they were from, yeah, they were not with me in the lessons, but it was super nice to, when I came to the Netherlands, it was not only like I'm alone here in this country. I already brought a bunch of friends. So I think that's a
Yes.
good thing from Academia Neerlandesa, that you also don't go alone. You already have friends to go out to share the same experiences. Yeah, I think
Ye-
that's an important thing, especially if you're a young person moving to another country. Can imagine that as a young person, then it's a bit more scary.
Yes, it could be a bit scary and also a bit stressful. So if you have someone and if you have the structure and also the company that helps you, yeah, with everything, yeah. So I think it's much more easier. But of course, the friends or and it's very important to have someone. And what level did you reach at Academia of Dutch? Sorry, at Academia Neerlandesa.
Well, we learn at my time. We learn for B1. So I had around a B1. Some people, if they stay the 4 months, they could learn up to a B2. And we do exams on Academia Neerlandesa to prepare for the real exam in the Netherlands. So you have a bit of a view of what level you have. I was lucky. I passed my exams at Academia Neerlandesa, and then when I moved to the Netherlands and did the real exam, I also passed it. So I'm just maybe very lucky. I don't know.
Or well prepared, though.
No, okay. Well, I
Yeah.
also did study quite much, but yeah. But that's what you need. Actually, you only need a B1 to register as a nurse in the Netherlands. So that's not so hard.
Mhm. So you reached your level, then you moved to the Netherlands, you passed the B level exam. And what about big registration and registration to become a nurse in the Netherlands? How long did it take you?
Well, the big registration, for the people that doesn't know, is the number you need to know to work as a registered nurse. In Spain, that's the número de colegiado. So from the moment I did the exam until I had my number and my card, it was about 3 months. The diploma, if you pass it, after one time, you get it around like 1 month after, and then it took me like 2 months to do all the registration. I think it's also a good idea to gather already many documents. So the moment that you have your diploma, you can apply, and then it doesn't take that long. If you wait until you have your diploma and then you start gathering all the documents, then it can take longer. So prepare yourself a little bit up front, and it won't take that long.
I see. And what was your first job in the Netherlands? Tell us about it.
Flashbacks. No, my first job was I was a nurse that came to the houses of people to give them care. So that means I went with my bike to the houses, and sometimes I had to help people with a bit daily tasks, medication. I also had to give injections, and after a year doing that type of job, I was offered by the Dutch company I was with to do a bit more complex work. So we offered also palliative care at home because in the Netherlands at that time, euthanasias were also already legal. That was in Spain in 2019, not yet the case. So for me, it was a very new experience. I said to the company as well, like, this is something I've never done, but they offered me a course, they offered me education to be able to do it. So my beginnings were a bit like basic care, and then I grew into doing complex care at home.
I see. And did you start working from in the Netherlands from the beginning when you arrived there?
Yeah. I arrived the 8th of December and I started working the 15th of December. So I had like a couple of days to settle. But to be honest, I was also very motivated. I was studying Dutch for many months at Academia Neerlandesa, so I really wanted to put that in practice. So I started working right away, and I think it's a good idea to do it if you have the chance to, because it's like ripping a bandage. But if you also have the time to move and that you start working maybe a month or 2 months after, then you can just prepare for the exam a bit more calmly, or just get to know the city a bit better. Yeah.
Yes.
But in my case, it was right away.
Yes, I see. Yes, it's important that you will do the B level exam in the Netherlands. Yes, so. Mhm. And what about the second job? Then you switched to another job. What was it? Tell us.
Yeah, so you get offer a job with EMTG, and you have to finish the job. In case you want to stay in that company, you can do it. Normally, they want to offer you like another type of job or a higher position for you to stay. And in case you want to try something new, that's always possible. I wanted to see a bit what I liked, so I went to a hospital. I was also in a nursing home, and yeah, I would motivate people to just try and see what they like. Right now, I'm working in public healthcare already for more than 3 years, and I'm actually glad that I did look different things to see what I like the most. Yeah, so in every job you have to adapt a little bit, I would say. It's a bit different, but it is very interesting to see the difference between my own country and the Netherlands. Yeah.
So would be the question. What also in the healthcare, what differences do you see now as a nurse with experience working in another country? What differences do you see between Netherlands and, yeah, let's say your home country, Spain?
I think like the biggest structural difference is that here in the Netherlands you can apply to a job. So that means that you don't have to wait, like I said. For example, in Spain, you have to wait until you're called and they offer you a job. You are the person that decides, I want to apply to this hospital, but you don't only choose the hospital, but you also choose the department. You say like, no, I want to work in the children's department. So that's already a big difference. Another difference, and I think very important, is that in the Netherlands and in Spain, and I think this is for most European countries the same, our degrees are the same. So we come to the Netherlands, we only have to do a Dutch language exam, and then we can practice nursing here. So that means that what they expect from us is the same. But here in the Netherlands, we also help with the basic care. So, for example, I've had to help people take a shower or just put their clothes on, and that's very normal. And it doesn't matter here in the Netherlands if you work in a nursing home or if you work in intensive care. Doesn't matter. Those are also things that you're expected to do in the Netherlands. And another difference is how they have arranged here the nursing specialties. In some countries, in Spain, we only have I think around 5 or 6 specialties that are recognized. For example, midwife, psychiatry, etc. But here in the Netherlands, there's way more. So, for example, if you work in a dialysis department, after you have a bit of experience, they can offer you a study of about like 1.5 years to become a nurse specialist in dialysis. And that's something that in some countries you have to search for yourself, like a master, and pay it yourself. But here in the Netherlands, there's way more specialties, and they also finance that for you, so you don't have to pay yourself for the education. So I think those 3 or 4 things that I said were like the biggest differences.
And from your experience to become a specialist nurse, how much time does a nurse need?
Well, it depends on the specialty, of course. I finished last year, June, and a specialty in public healthcare that was financed by my job, and it was 1.5 years. So, for example, if I would have a week where I have to work 4 days, then I would go 3 days to my work, and 1 day I went to university. And sometimes my own job, they gave me time to do my projects, to do my sort of homework or to study during work. So it was not expected from me to do this time at my to do these things at my free time. So that also felt very good.
That's perfect. Okay, and maybe you can tell us about your current working place and how does your day at work look like?
Well, I work for the municipality of Amsterdam in the Department of Infectious Diseases. So we manage the outbreaks in the city. So sometimes, normally we have to do a lot of phone work, and also there's a lot of people that come to my work to get vaccinations, to do blood tests, and sometimes we have to like travel to the place where there's an outbreak. So yeah, it's mostly public healthcare and a lot of prevention. So talking with people on the streets, sometimes at Pride, we talk about the use of condoms and stuff like that.
Okay, and how many hours a week do you work?
I currently work 36 hours a week. So one week I have 5 days and the other one I have 4.
So I think this is what attracts also professionals to work also in the Netherlands, because you could have longer weekend, 3 days of weekend every 2 or 3 weeks. So I think this could be very interesting. I think last question from my my side. What advice maybe would you give to the nurses or assistant nurses who are thinking about moving abroad?
Well, I think, as I said, it's very important to gather a lot of information. I think it's good when you go to a new country to get surprised by the place, but believe me, you're gonna get enough surprises. So the more you know, the better. So just talk with people that you know they're there. Talk with the MTG, talk with who you want, but gather this information, be prepared, and go there motivated. I also had sometimes I spoke with people that told me that they have a bad experience. Of course, I thought, oh, that's so bad for you, but I want to hear from people that had a successful experience. I want to know what they did so that it would be for me the same. And just, yeah, be motivated with the language. I also had days that I thought, I don't understand, but yeah, almost everybody in my class is now still in the Netherlands and doing their life in Dutch. Yeah, so just come with a good mindset, be positive, and work hard. Yeah.
Yes, thank you very much for all your answers, Helena. So it was a pleasure. If someone of you have any questions, maybe Johan, if you have something you would like to ask, yeah, go
I
ahead.
do questions.
Yeah.
I don't I don't want interruption. Uh, the one, the
Mhm.
classroom is only in Spain. The 4 days.
Uh, you mean if the
Digo que si
place is
las
located?
clases de holandés únicamente en España.
Oh, so you mean where is the academy? Where
Yeah,
is it
academy.
located? Yeah. Well, I went to Academia Neerlandesa in Alicante. So yeah, I don't think at the moment that there's lessons. I look at you, Natalia, in the Netherlands.
No, we don't have lessons in the Netherlands. They are currently only in Spain. Yeah, so there could be a combination of online classes for some time and then to come to Spain and spend there. But our experience showed that because there were courses also in the Netherlands, also online, or in the home countries of the participants. But the best results the students show when they are somewhere else where they live separately from
Like
their home. Yes, because at home you
sense.
have your friends, your family, and you also tend to work. It's also different because, oh, why should I study all the time? I could work a bit, know some shifts, and then you will
It's
not
wrong.
get good results at the end of the course. So that's why the company decided, so that's better to do it in one place, yeah, with other participants to motivate each other. It's in Spain. Yes, Javier.
Y,
I.
y,
Mhm.
how much the price, the course for el curso? ¿Cuánto sería el precio del curso?
Yeah, well, I didn't have to pay anything for the course. I think I had to pay like 50 euros or something like that, but that would be only if I would break something in the house. I didn't break
Yes.
anything.
Yes.
I didn't break anything, so they gave me that money back. So the course is not per se for free because they're like an intermediary company. So that means that um, because of their relationships with Dutch companies, that's how the company makes profit. But you just go there and study Dutch, and you don't have to pay any accommodation or for the course or anything. I don't know if the books have to be paid
Yes, you
yourself.
have to
That's
pay.
the only
Yes.
thing,
Yeah, you have to pay
like
for
the
the
books.
books only. Hmm.
Yeah. So
Everything
that,
is free for you, but of course, then you will have the contract with the employer and you would need to work this contract. But the course is free.
yeah, exactly. So that was my first job. What I mentioned about going with the bike, that was like that job.
Yes.
I explain my caso for 2 minutes.
Mhm.
Mhm.
For example, um, now I living in Harlem, in Amsterdam, Harlem. Now
Mhm. Okay.
I working the chef now, yeah. But I would like learn
You're
Dutch,
already in the
yeah.
Netherlands.
Yeah, because I have my diploma, the nurse. O sea, mira, digo, one second, mira. I have a diploma warranty, yes?
Is it nurse?
Yes, yes. de
Mhm.
nurse.
That's
But did you
perfect.
do already the big registration?
Ya, solo necesito, es el Big Register, que es el examen, es only need the Big Register, but, porque es para, aquí dice que necesito el idioma para poder ejercer.
Sí.
You need the Dutch language, no? The Dutch.
Sí.
Uh-huh. Yes, the
Em,
Dutch level. B1.
Según vi en el esquema que usted mostró, que es I show you in your presentation, that is for level 1, 2, 3, MBO, ABO, ya. My cast, I am instrumentist, asistente nurse, instrumentista quirúrgico, operating room.
Yeah, and you studied that in the Netherlands or somewhere else?
En Netherlands, I don't know, en Holanda no sé cómo es aquí
No,
para
in
eso.
Spain probably, no?
But where
En,
did you
en
study
Spain sí.
that study?
In Spain?
En Spain, I have ya cirugía, operating room, yes.
Uh-huh.
Pero,
That's a different job than being a nurse, right? That's like
but I
a
don't know.
different position.
¿Cómo? No entendí.
Ser instrumentista y enfermero son diferentes posiciones. ¿O tú estudiaste primero enfermería y luego instrumentista?
No, estudié primero enfermería. ¿vale?
Entonces eres enfermero general y luego
Y luego hice un curso de instrumentista quirúrgico en Holanda, e incluso el diploma es de Curaçao, porque tengo un máster de Holanda, un máster en las Antillas holandesas. I have the manager for the...
Okay, I understand now.
Yeah.
So he is a nurse. He is a nurse. He has the degree. And he also, because you already live in the Netherlands, you did complementary education that allows you to be work in the operating room. Okay. I don't know. I think it would be good if we would schedule maybe another time to talk a bit more about your situation and see if EMTG can help you in any way. I think that would be good. And you live in Haarlem. We live very close. So I can also visit you. Yeah, I can also visit you. We can have a coffee and talk about it.
Yeah, so then we can schedule something so you can discuss what could be the possibilities you can also explain more about your diploma. And yeah, this could be good.
Nice. Thank you so much.
No
Yeah, of
problem.
course.
How you live.
And I wanted to
here my contacts in the chat so that you can. I don't know if I wrote something or not.
Not yet. And while you're writing, I would like to ask Marta if you have any questions to Helena or to me. No, we don't see Helena, not yet. I think no.
Yeah. You can find me here and send me a message. Maybe you can allow Marta to also speak and have her microphone.
Let me see. It's working. No, I think no mic. No. But how does it work for people in other countries? Low. Oh, I can, yeah, because it was me who is allowing the cameras and micros. But yeah, I didn't pay attention that you would like to say something. I don't know now if it's working, Marta.
Yes, I think it's working now.
Yeah. Nice to meet you.
Nice to meet you. I live in Brazil. I'm studying nursing school right now. I'm in second year. Um, I want to know how can I apply from here if it's possible, and what
Yes.
is
So
if you have I don't know how to say in English right now. I don't know. You have age limits, something like this. I have um European citizen, but now I live in Brazil.
yes, but you study also in Brazil, or?
Yes, yes, I'm studying Brazil.
So this could be an obstacle because what we except we accept we accept people with European diplomas. So because then the title will be automatically recognized with the B1 level of Dutch language. So I don't know how it works for non-Europeans. So probably it's a longer process. Of course, it doesn't mean that you cannot find a job there or get probably registered, but it's a long process. No, what do you think, Helena?
Yeah, it is a bit harder for people that come from other continents. I was once helping doctor from Venezuela that came to the Netherlands, but the thing is that here in Spain, because of the Bologna program, that means that people that studied a bachelor in Spain, Portugal, France, Italy, Germany, etc., we can work in Europe because it's 4 years and we have the same study programs. So we only need the language, like Johan said, to register. And I think for people that come from other continents, because it's not the same study program, you will also have to do maybe an exam, not only language, but also about nursing itself. So
Yes, I
it's
also
not
think so.
impossible, but EMTG doesn't help with that because it's quite a longer process. But you can, of course, I think I would, in your case, try to find somebody from Brazil that has already done it. Yeah, and ask them how they did it. Yeah.
Yes, and how long it took them.
Okay, thank you.
Of
Thank you
course.
for joining us. Yes. So any other questions, someone?
Well, I think,
So
Johan, you can, that's my Instagram, or you can also send an email. But let me know a bit more about your situation. And I will discuss with Natalia if we can do something from EMTG, or maybe that I can just give you advice. Yeah.
Yeah, I now follow you. Yeah, everything.
so quick, yes.
Yeah, this
Yeah,
generations.
generation. Yes, that's right. So I would say thank you everyone for participating at this webinar. So yeah, you can contact us also on EMTG NL and find also some job offers there. You can call the office in the Netherlands. We would be glad to hear from you if you have any other questions that we can answer them. Thanks for joining us today.